The function of ocular muscles are going to be to help our eyes move. Now, let's say that this is the right eye, and let's say that this is the left eye. If there was damage to the right medial rectus, the right eye would not be able to adduct. If there was damage to the right lateral rectus, then the right eye would not be able to abduct. If there was damage to the right superior rectus, then we won't see any elevation. And if there was damage to the right inferior rectus, there won't be any depression in the right eye. Now it gets a little bit more complicated with the superior oblique and the inferior oblique. The superior oblique's function is going to be to abduct, depress, and internally rotate. So it can ultimately help our eye look down and out like this. So if there is damage to the superior oblique, then the eye would kind of go medially and outward like this, like in the blue arrow. This would be if there was damage to the superior oblique muscle. Now the inferior oblique is going to help our eye abduct, elevate, and externally rotate. So its ultimate function is going to be to help our eye look up and out like this. Now, let's go to the next page to discuss the nerve supply to these muscles. And you can remember all the nerve supplies with LR6, SO4, R3. So the lateral rectus muscle is going to be innervated by cranial nerve 6. Superior oblique muscle is going to be innervated by cranial nerve 4. And the rest of the ocular muscles are going to be innervated by cranial nerve 3. So this is a little mnemonic to remember all the nerve supply to the muscles. So the lateral rectus is going to be supplied by cranial nerve 6. And if there is a lesion, then there is going to be medial deviation. So the eye will kind of go like this if there is damage to the lateral rectus muscle. If there is damage to the superior oblique muscle, which is supplied by cranial nerve 4, then the eye would look medial and outward like this. If there was damage to the cranial nerve 3, then the eye would result in looking, so there will be mydriasis, so the pupil would dilate, and there will be lateral and downward deviation like this. So if there is damage to the right cranial nerve 3, so the right eye would look like this and the left eye would be normal.